a quick update and things I'm looking forward to. So, as everyone knows, if you follow my channel, if you don't subscribe, please do. So hit the subscribe button and you can follow my journey, and I am trying to help others with my journey, and I'm also trying to get more information out there for everyone. I essentially have become an advocate for information of things I didn't know about or really plan on. So there you go. I talk about myeloproliferative neoplasms. I have polycythemia vera, and also currently I'm dealing with a clot in the heart and pulmonary emboli, or embolisms. And I'm just trying to make the best out of things. What can you do other than help others? So currently I went to see multiple doctors. We did have the echocardiogram. The follow-up showed that there was just a small amount of change, I guess just a little bit, like relatively not much. Apparently there was concern because it's dangling, right? So you'd think that it would kind of wear away a little bit more. That was something to look into. We've talked about replacing the part of my port, I guess. Not only does it stick in, but it goes beyond where it should be in the heart. And so they need to pull that line out, and they could replace it with something shorter, or, to my hopes and prayers, I could have it removed, which would be everything. So one of my doctors, we talked to her the other day, and she brought up the suggestion. She said, well, has anyone talked to you about getting rid of the port altogether? And I just looked at her and I was so excited because my husband and son were both there at the time. And I'm like, I have not been able to give my son a full, true hug, like embrace him fully without pain or fear or something uncomfortable. I am dreaming for that day. Literally, I mean, he's 3 years old and most of the time I've had this. That is my dream, to have the port gone, beyond all the medical issues. So, that does make a problem because I have the Portacath, which has been amazing for getting phlebotomies because all my veins are poop. I did have an ultrasound recently. She did find one that was viable and pretty good, actually. It's just that you'd have to use the ultrasound to get to it. So that's, kind of a rough one. And then I went to the apheresis before I had the port placed. And with that, even they came in and said, your veins are just shot. You have to get the port. So it wasn't that we did the decision to do a port just out of the blue or just convenience or something. It was thought out. We tried many avenues. It's not recommended when you have PV, obviously. And here I go, having issues, having the port. So having the port plus PV is not a good mix. It's not a combination you want, especially because I'm pretty much evidence as to why they don't recommend it. And sometimes you do things rock in a hard place. I think pretty much most of my treatment at this point is rock in a hard place. And what do? Well, you try your best. So we did get the port placed. It worked well while we needed it. I am going to, obviously we want to take out the port for so many reasons. It's not a good thing anyway. There's no guarantee that I won't get more clots now that I've already had one there. My lungs, everything. I am freaking lucky to be where I am anyhow. I am going to be starting interferon or pegasys in about 2 weeks. So that is really exciting for me. I was actually extremely scared when I looked up pegasys because if you have depression, which I do, usually circumstantial. So I'm feeling okay about that, but it can really emphasize it. It can get scary. But you know what? What if all the bad things it has, what if none of those happen and it's all good? What are the possibilities? What are the amazing possibilities? What if it works? I don't know. I want to take that because I need to feel better. I need to do better. I want to be more. So hopefully the interferon will work. Actually, usually it is prescribed for hepatitis C. So some people might think, what? Why would you do that? But it's a one-off to go for an MPN. So I'm really, hoping when the doctor actually recommended it. It's been a long time. I had two contradicting recommendations at the same time. So that's one reason I didn't take the other. Long story. Then once I actually received it, because they have to go through some hoops to actually get it okayed, I get it okayed, and then I get the clot in the heart. So we had to kind of pause all that. And now I don't know that we're going to actually totally wait for this clot to go because it's taking a bit longer. There was kind of a timeline with the lungs. We expected about a year. I personally was thinking like 10 minutes. But the doctor in the ER said, it's going to be about a year with your situation. I'm like, okay, that's, what do you do, right? But the heart, I truly expected to go a lot faster. And I swear I felt so much better after that one time because it's dangling. So you'd think maybe that thin part would wear away and go off. I don't know. So there are actually a lot of things that are giving me hope, and I'm just so excited. If the clot goes away, if I get the port out, say the best, case scenario, the interferon's working and I'm awesome. Dreams, this is my dream, right? And yes, I'm super excited. And yeah, we have not got it cleared whatsoever about taking the port out. There have to be like different departments aware of it and okay with it. We don't know what's going to happen with the clot. I mean, I know there's tons of things we haven't even figured out, but with all the things that are not figured out, at least we're trying our options. We're looking, we're saying, okay, let's do what we can, because I'm so sick of being in this, I'm not feeling well. And, it sucks. And as soon as like the heart can be done, the lungs hopefully will clear up, all these things, I can do my exercising, I can do all these things, and it'll give me even more energy and I'll feel better to help others. I mean, there's just so much. Anyway, I've got some rose-colored glasses on and I'm just dreaming and hoping and praying and all of that. I want to be better. I took my doctor's advice or suggestion or whatever it was the other day and ran with it a little bit. I cleaned up my backyard. It's driving me nuts. It's a huge mess. And I'm done. I am not going back out for more yard work. I want to, but I am so tired. I went for a walk with my son around the block today. It was so thoroughly exhausting. I thought I was going to cry like when we hit the corner. But we went. We persisted, and that's the important part. And we came home. I said, lay down on the bed and I'm going to come back with books. I went back and he was already snoring. So he is napping. I'm going to get some lunch and I am going to just snuggle in with him and just be grateful. So currently that is where my treatment is. With this, hopefully good news, wishes, rose-colored glasses, dreams, all of that. I'm wishing you all good health and happiness and contentment and peace and kindness and caring and love and all those wonderful things, and seeing the gift in the struggle. I'm blessed to know people who do the same, and I am so proud of all my friends, and I see a lot of struggling going on, especially in the MPN community, the chronic illness, all those things. But beyond that, just everyone regular, I just see everyone going through these things, and I see so many people appreciate blessings and learning the lesson through the hardship, and it just makes you so much more grateful. Anyhow, I'm wishing everyone the best.